Hi, I'm Rhonda Anderson with the American Diabetes Association. I'm here at the 6th Disparities Partnership Forum in Crystal City, Virginia. I'm so excited to welcome Dr. Jeffrey Henderson. He is the CEO and president of the Black Hills Center for American Indian Health. Thanks so much for joining me today.
Thanks very much. It's a pleasure to join you.
I was in the room during your the panel discussion in which you participated, and I thought it was there was some very interesting information shared. What I'd like to know is how, what specific concerns do you bring to the table when you're dealing with care for American Indians and Alaska Natives?
I have to be sure that I pay attention to culture and cultural factors. Not all of my patients are the same, even if they might all be Lakota, for instance. They may have different explanations for why they have diabetes. Some of those might be culturally founded. And so it's important for me to elicit those explanations first before I can decide on a really effective strategy moving forward.
So in terms of empowering them to be more proactive in their preventative care or just being very aggressive with their diabetes maintenance, what do you want them to know? What steps do you need them to take?
I view patients most of the time as an onion. And so our goal in therapy is to gradually take off those layers of the onion to get down to what is most impactful, most motivational for those patients. That can take a short amount of time, that can take a long amount of time. One good example of that is Polypharmacy. Many of my patients, when I first see them, are on a literal garbage bag full of medications. In fact, I actually have them bring in, I take a black garbage bag and take every medication out of their household, whether it has their name on it or not, and bring it in for us to take a look at. What you'll usually see is, well, you can imagine what we see, right? And so trying to get a handle on that, explaining each one. Education, it's been mentioned here at the conference already, making the time to have a really good heart-to-heart discussion with patients is really important.
So you mentioned taking that time with patients. What else have you heard at the partnership forum so far that you feel you can take back and apply immediately within your practice?
Be persistent, and of course just the natural practices sort of taught me that too, but it's always good to be reminded of that. Be persistent. Be hopeful. You know, I think that all too often discussions about diabetes always are cast in a disparities framework or a deficit-based model. And I'm very much interested in transitioning that to an asset-based perspective on viewing the challenges that we have with diabetes. And that's one of the main messages I've brought to share here.
Well, that was a very hopeful one. Thank you for sharing that with us. We'll be getting more information from the 6th Disparities Partnership Forum. Thank you.